Love Bay family, and welcome back to the Mental Health Hour, your space for real conversations, meaningful reflection, and community centered healing. I'm your host, Felicia Fishoff, registered psychotherapist and founder of Rooted in Resilience Psychotherapy and Wellness, where we believe healing happens in relationship, in culture, and in connection. Tonight is Wild Card Tuesday, and we're diving into a conversation that is both deeply needed and often misunderstood. Our topic for tonight is Behind the Behavior, a compassionate look at addiction beneath the surface. Now, often when we think about addiction, we focus on what we can see, the behaviors, the patterns, the consequences. But what we don't always talk about is what's underneath, the pain, the unmet needs, the survival strategies. And tonight, we're also going to take some time to get a deeper understanding of the biological processes behind addiction, what's happening in the brain and body, and how that shapes behavior in ways that are often misunderstood. Tonight, we're shifting the lens. We're exploring addiction not as a moral failure, but as something shaped by lived experience, trauma, and the environments people are navigating every single day. We're also going to be unpacking the impact of stigma, cultural narratives around addiction, and the systemic barriers that make it harder for people to access care. Because healing doesn't happen in isolation, it happens in spaces where people feel seen, safe, and supported. Before we get into tonight's conversation, I just want to gently remind you that this space is for education, reflection, and community conversation, but it is not a substitute for therapy or crisis support. If anything we talk about tonight feels close to home, I want you to know that you don't have to carry that alone. Please consider reaching out to a licensed mental health professional in your area, someone you trust, or a local support line. And as always, we invite you to take care of yourself while listening. Pause if you need to breathe, step away, come back. Your well being matters here. And the chat is also open, love based. So please drop your questions and comments in the chat. Also, invite your aunties, your uncles, your cousins, and your friends to tune in because tonight is going to be a rich and wholesome conversation. So let's get into it. Hey,
How's it going?
I
Another
am well.
conversation.
How are you? Oh my
Good.
goodness. I am so excited to have you all here. I really wanted to just take even a personal approach at introducing you all tonight because I think that, like we were mentioning in the back room before the show started, I feel like each of you have had just a pivotal. You guys were introduced into my life during pivotal moments, right? And so I will start with Mr. Andrew Roach. So, Andrew is a harm reduction counselor with a plethora of experience. And he has just been doing phenomenal work in the community. And then there is Josh Dale, registered psychotherapist, soon to be practice owner. Yes.
Hey.
Yes. And of course, he's not a stranger to the Love Bay family. He is also on our Baba Shop Tuesday panel. And so he has done amazing work with the topic of addictions. He's been doing addictions work for many years, and this carries over also into his therapy career. And Dr. Adrienne Sequeira, she is just an amazing woman. She is a professor at Tyndale University. So she is actually one of my professors, y'all. So I am so excited. She runs an addictions course there, which was pivotal in my own learning as a psychotherapist. She's also an RN. She's also a registered psychotherapist. She's a psychoanalytic consultant or coach or oh
I'm
my
a
goodness,
certified psychoanalyst. Yeah.
certified
Wow, here we go. This
certified psychoanalyst, right? And she is also doing such amazing work as it relates to trauma and addictions work. So tonight, guys, I'm telling you, invite your aunties, invite your uncles, because we're gonna get into it tonight. You know, I usually love to start off these conversations just by asking, why does the Love Bay family need to be talking about this topic tonight?
Mhm. Who wants to start us off?
I can start us off.
Yeah.
Yes.
I think so. I've been in the addictions field for over 10 years now.
Yes.
And I feel that anytime that we talk about addictions, there can be quite a lot of stigma around it. There can be
Mm-hmm.
a lot of misconceptions, a lot of wrong views and points on it. But I feel like addiction touches so many people. When I talk to
Mm-hmm.
people about it and they are able to open up, they're able to say, well,
Mm-hmm.
my someone in my family was addicted to something, or I know
Yeah.
one of my friends were struggling with this for a little bit. So it
Mm-hmm.
touches so many people, but it's something that people don't
Yeah.
necessarily want to talk about in that
Hmm.
sense. So I feel
Absolutely.
like this is an
Yeah.
important conversation for that
Mm-hmm.
reason of just getting more information on that, and also just
Yes.
coming up and being more honest and open about it as well.
Hmm.
Because
That's
I
good.
do think that the more that we repress and like hide certain things, the more that it just bubbles up, and then we realize
Mm-hmm.
that there's more people that are kind of like us or struggling or have
Mm-hmm.
family members and people that we know that are dealing with this. And the more that
Yes.
we talk about it, the more that we can kind of come together as a community. So
Hmm.
I think it's a really important conversation tonight.
Yeah.
Yes, Andrew.
Can I
Absolutely.
piggyback off that? I think
Yes.
going off what you're saying, Andrew, really having these conversations breaks down the taboo that is around
Hmm.
addiction, right? A lot of people have those stigmas, or oh, addiction is dirty, or it's over here, or I would never. But we
Mm,
see that like so many, as you said, so many lives are impacted by addiction, and it's not necessarily just
yes.
what we typically think of. Oh, just drugs. There's so many things that people find
Yes.
themselves addicted to in that addiction cycle. And I think as we break
Mm-hmm.
down the taboo, this allows us to do so much greater work on a personal level, on a
Yes.
familial level, and even at a community level, right? It's hard to
Yes.
do sometimes that community work. And maybe you know about this, Andrew, but I know having the conversations of harm
Yes.
reduction and certain harm reduction things that are in the community, people are like, why are you doing
Yeah.
that? Like you have your
Hmm.
safe injection sites
Mm,
and those things, and why is this
Hmm.
happening, and why? But I think as we break down that taboo, we're able to do more work on each of those levels, personal, for people to come forward personally, for
Yeah.
to be able to help family members, and then to do that deeper community work that's needed. So
mm-hmm.
Hmm.
that's some of my favorite things of talking about and why it's such an important topic.
Yeah.
Mm-hmm.
Yeah. I'll jump in with a little bit as well.
Yes.
Yeah, something that's um, close to my heart. Working
Mm,
in psychotherapy is families. There's so many families who are suffering, uh,
yes.
and who don't know how to support their family members, and feel
Mm,
so hopeless around that. So that's a big area as well. Yeah.
Hmm.
absolutely. And we already have someone in the chat, Jen Lewis, is saying, and not just the individuals with addictions, but the
Yes.
people around them, how to
Amen.
support, how to love, and how to care.
Yeah.
Absolutely.
Can I
Absolutely.
sneak in there too? Because that was one of my
Yes.
favorite things. I was at when I was at Bible college. There was a woman that was just she was probably close to 80. She was just auditing a course, and she was like
Mm,
the resident grandma, and getting to talk to her and getting to know deeper about her story. And I've done
mm,
a lot of work and have experience in terms of like Alcoholics Anonymous, but she was telling her experience about Al-Anon, which is the family
Hmm.
members impacted by those
yes.
yeah, the alcoholism and things with that. And it was just amazing to hear her experience of how great the support has been and how important it is, because that's
Yes.
sometimes what you don't think about are the families that are impacted, right? You think of
Mm,
addiction, you think of the individual, but the
yes.
families that are impacted. And so the support, how many years that she was involved with that, and receiving support and giving support. So love what Adrian said, and love what Jen Lewis said as well, is the
Hmm.
people around, how to support, how to
Yes.
love, how to care.
Absolutely. Absolutely. So I know that we kind of hinted towards some of the stigmas that are out there, especially as it relates to addiction, especially from like a cultural context. I think that there often addictions get gets a bad rap. It's either super normalized in our cultures, in our communities, or it's completely stigmatized on the other end, right? So what have you guys noticed in your own, whether it's your personal experience or your professional experience, as it relates to the stigmas that are out there?
Mm.
I think what I've noticed is people saying, well, they just don't have enough willpower to get over it, or they're
Mm,
not strong enough, or everyone goes through issues.
yes.
Why can't they deal with it in a different way? So we've heard so many
Mm-hmm.
negative connotations around people who are using substances, and
Yes.
not necessarily the compassion around it, not knowing that
Yeah.
99% of the clients that I see don't want to be in the position that they're in.
Hmm.
They just feel stuck.
Yes.
They feel like there's so many
Mm-hmm.
environmental things happening. There's a lot of trauma that they're trying to heal from. There's a lot of things that they have to
Yes.
like uncover. But I
Yes.
think from the outside perception, it's just a lot of, oh, they're just not strong enough. They're not like me. So therefore, I don't really have compassion for them. And that's
Mm,
one of the main stigmas that I see towards this community.
Yeah. Yeah.
absolutely.
I think people create this archetype of who an addict is, and so
Mm,
they classify people, and it's kind of like, oh, you're dirty, or there's
mm,
this very
Mhm.
negative opinion in terms of people struggling with addictions. And what I've seen, and maybe this is an interesting to talk about further, is like in having that archetype or having a poster child, and these are who people are addicted, and we remove ourselves from that, is actually
mm,
sometimes it doesn't allow people to be honest with themselves, right? So
Mhm.
it's like, oh, this person, uh, typical addict is using needles, and then they
mm-hmm.
are soothing themselves through a glass of wine every night,
Yeah.
and maybe it's causing issues within their. But they're like, well, I'm not this archetype. I'm not struggling with
Mm-hmm.
that. I'm not an addict. And so I think
Mm-hmm.
breaking down the stigmas of who addiction impacts, and
Mhm.
that it doesn't have to be this
Yes.
taboo. We don't have to have an archetype, right? And we don't have
Mm-hmm.
to bring that judgment to people. And I think that's
Mm-hmm.
something that I'd love to even just talk about further. Yeah.
Mhm.
Mm-hmm. Mm-hmm.
Yeah. One, sometimes one can have a very simplistic view of what it's going to take to overcome the addictive behavior, and
Mm,
this can lead to a lot of hopelessness in family members and so on, because they don't understand
yes.
the relapsing chronic nature
Mhm.
what
Yes.
someone has developed,
Mm-hmm.
full-blown addiction with the dependence, and
Yeah.
the physiological dependence, and
Mm-hmm.
the neuro, the brain changes that take place
Mhm.
as well. Yeah.
Yes,
Hmm.
yes, absolutely. And
Mhm.
I love that you brought in the biological impact of addictions, because I think that, and I learned this from you, Dr. Sequeira, right, is that, you know, overcoming an addiction isn't a linear experience, right?
Mhm.
Whereas people be like, well, if you are addicted, just quit. It is not so simple, right? And, anyone can jump in. But what
Yeah.
are some of the biological impacts on the body? And because I think that if people can get a better understanding, that it's not so simple to just
Mhm.
put down the bottle or
Hmm.
put down the syringe,
Hmm.
or even turn off the TV, because there's so
Hmm.
many different types of addictions, but there is this biological response.
Yeah.
Yeah.
One of the things that I really like,
Hmm.
I'm sure most of us are familiar with, and I never can pronounce his name, but Gabor Mate.
Good point.
And in just
Yeah.
yeah,
Mhm.
in just one of his interviews, he talks about people dealing with heroin addiction,
Mhm.
and just saying it's
Mm,
almost like this sense of a warm hug. If you
Mhm.
take that and you continue with that, there's this sense of um, within trauma that people have experienced, right? There's this
yeah.
need for a sense of soothing. Like there's this need, right? As you have high levels of adrenaline and cortisol, and you realize the great impacts that oxytocin can have on that, then it makes sense that if it
Hmm.
feels like a warm hug, if it's releasing oxytocin, if it helps them dealing with that stress and
Yes.
cortisol, that of course their body would be used to and want to reach out to that. And so I'm just seeing the how trauma impacts the body, and that addiction seems to be this outlet, a really big outlet,
Mm.
to mitigate or regulate
Mhm.
impacts of trauma in our bodies, especially at the
Mm.
level of our nervous system. So
Yeah.
I really see that in my clients, of seeing as they tell me their history and
Mm.
if we talk about their window of tolerance, their time in hyperarousal and hypoarousal and all that kind of stuff, they can be
Yes.
Mhm.
anxious and just chronically. It makes sense that for soothing, it makes sense that for the
Yeah.
sense of feeling, that love chemical, or even in a sense of
Mhm.
connection, that they would go to something like addiction. So
Mm.
man, I love just learning more about the nervous system, and just getting
Mm.
to apply it to the concept and the experience of addiction, because it makes a lot of it makes so much sense. Anyone
Mm.
else's
Yeah.
thoughts? And I could talk about it for forever.
Yeah, for hours, I understand. I think for what I've seen
Mm.
is a lot of the clients feel stuck because of the withdrawal symptoms, the biological stuff that's going on during
Mm.
withdrawal. So depending on the substance that they're taking,
Yeah.
that withdrawal usually has the opposite effect of what that substance gives them, and
Yes.
usually that's extremely negative. So for
Mm.
someone who's taking something like heroin or opioids like fentanyl or something, the
Yes.
opposite effect of they feel completely sedated or flu-like symptoms, and they feel so sick.
Mm.
So they feel like I'm craving just to not feel like this anymore. And one of the
Yes.
more dangerous substances to actually withdraw from that we actually look at as in society as we legalize it and we
Yeah.
celebrate alcohol.
Yeah.
And we have a lot
100.
of stigma, or like a lot of things with alcohol that we kind of just put it in our social settings, everything. But if someone
Mm.
is dependent on alcohol, and let's say they're having 8 drinks a day, it would be completely dangerous for
Mm.
them to stop completely cold turkey. Like they would have to take steps down, because there's so much dangerous things that can happen in terms of seizure, or heart
Mm.
failure, or something like that happening. So I think there's so many things with withdrawal symptoms that
Mhm.
people who are using, they continue to try to
Yeah.
mitigate the feelings with that, and that's just a biological aspect, and that keeps them stuck because it's a hard thing to get over. But
Mhm.
a lot of people in the outside world, or who are not a part of the community, won't necessarily see it like that.
Right.
Yes. Yes, absolutely.
Yeah.
Yeah. Yeah. Yeah, I really like what both of you have said, because
Mhm.
it's a bit of a double whammy, really, because
Mhm.
often what draws people into using in the first place is because they have some unhealed trauma that they're
Yes.
trying to soothe and to treat themselves, and
Mm.
people get drawn to certain substances depending on what they're trying to medicate. So if they're
Mhm.
anxious, for instance, they'll get drawn to a depressant, or what on the street is called a downer. And if they
Mhm.
are agitated and anxious, they'll get drawn to and use.
Mhm.
Um, sorry, they'll use depressants, and if they're depressed, they'll be drawn to
Stimulant. Mhm.
stimulants. And
Yes.
Mhm.
yeah, and then once they use it again and again and again, their bodies and their brains change, and that now
Yes.
they've got a new problem. It takes on a life of its own. And
Mhm.
Mhm.
then when you're thinking in terms of treatment, then they'll have, of course, all of the problems that go with you using as a full-time job, because that's what it
Mhm.
becomes. And
Yes.
then to try and treat that, there's a threshold. They have to treat the withdrawal first.
Mhm.
Yes.
And some substances, as you've mentioned, both of you have mentioned, are very compelling, and you can't just do it on your own. So
Yes.
Mhm.
now, when someone is ashamed of opening
Mm.
up about the problem, there's another
Mhm.
barrier there to seeking help. So yeah,
Yes.
it's a very, very complex picture
Mhm.
that emerges at the end. Yeah.
Absolutely. And I'm so glad that you guys talked about the fact that there's these huge withdrawal symptoms, because the withdrawal symptoms in and of itself can be very dangerous, right?
Mhm.
So I'm so glad that Andrew, you talked about even like addictions and being one of the most dangerous substances, right? Delirious tremens, Dr. Sequeira, right? um, and I think a lot of people don't realize that if you've been using a substance for long enough, if you take it away right away without, again, that proper support, or even that medical support, even the social support as well, because it literally does have a huge impact on the body, that some people can actually die from it, and people don't
Mhm.
realize that it can be that serious.
Mhm.
Yeah.
That's right. That's right.
Mhm.
Yeah.
Mhm.
And there's something that I've noticed as well, like in terms of
Yes.
dependency on certain substances,
Mhm.
like someone who might be dependent on alcohol might have less
Mhm.
stigma than someone who's dependent on crack cocaine, in that sense.
Mm.
But it's all the
Yes.
same dependency and addiction and everything as well. But
Yes.
based on legality and based on social structures, we look at
Mm.
it differently, or we might look at our nose down on someone else in a negative way, even
Mhm.
more so because of that. But each person is
Yes.
dealing with something in their mind, the trauma. And I would say 99% of the clients that I've encountered have faced some level of trauma. Most
Yeah.
of the clients that I've talked to have had some sort of either sports injury, they had some
Yes.
dark traumatic thing happen in their childhood, a car
Yes.
accident, and then they end up going to the doctor, getting prescribed medication, and then being able to like being hooked on that and going to the streets and doing
Yes.
that, or just trying to heal, like Josh was talking about, like something that happened in their childhood. So
Yes.
these are people who are not necessarily wanting to do this and be dependent on substances, but this is one of the coping mechanisms that people use to try to
Yes.
heal themselves and self-soothe.
Mhm.
So, and then just kind of gets out of hand and kind of spirals out of control even for them. So a lot of people
Mhm.
feel that stigma of like not going for help because they feel like I can help myself, or I need to help myself. I need to be strong enough, but it's a very difficult process.
Yeah.
Mhm.
Yeah. I think
Absolutely.
the barriers of support, like again, with that sense of it's stigmatized, it's considered
Hmm.
taboo. It's like,
Mhm.
sometimes people feel those barriers of support, right? They're either kicked out of their house, or
Mhm.
they're
Hmm.
passed over on the street, or whatever that looks like. And I think it can be very hard to not have that sense of community understanding and community support, right? The community
Mhm.
consists of a diverse group of people, right?
Mhm.
And they are part of the community. And I think what can help a community flourish is opening up that understanding, and being like, okay, like now that we're starting to understand, how can we support? But I've
Hmm.
seen that sometimes that's even hard, again, because of these stigmas that Andrew's talking about, and because of these
Mhm.
archetypes that we have. And yeah, it just makes sometimes it hard to even want to, or even know where to get help.
Yeah.
Mhm.
And also, I'm touched by uh,
Mhm.
yet another piece, which is,
Mhm.
not everyone is ready to quit. And
Yes.
so, people don't understand as well that sometimes there's a bit of a
Mm.
gap, and
Yes.
need to work with people in harm
Yes.
reduction, for instance, to get
Mhm.
Hmm.
them to a place, and just basically to save lives. So,
Yes.
there's a lot of myths around what harm reduction is, and
Mm.
there's also an understanding gap there.
Hmm.
Yes. So why don't we get into it? What is harm reduction?
So I would love to answer that question.
Yes.
I work in harm reduction, so I do hear a lot of the myths.
Mm.
So harm reduction is essentially just reducing harms around substance use and drugs. So
Mm.
ideally, we're looking at people who might be sharing needles, who might be sharing crack stems or bowls
Mm.
and everything. The mechanism in which they use to use their substance.
Mhm.
And what we've seen before is a high rate of hepatitis, of HIV, and ultimately
Mm.
overdose death. And those
Mm.
things don't necessarily have to be happening. So harm reduction it aims to reduce the safety risks that come along with substance
Mhm.
usage. Ideally, what we're looking
Mhm.
at for harm reduction is we're giving you the chance of living today for that hope for tomorrow, that you're able
Mhm.
to kind of change tomorrow, but you can't change if if you're dead today. So we want to keep
Yeah.
trying to prolong the people who are using substances, their lives, and then giving them a community and an essence of an avenue
Mm,
of actually getting to treatment. But a lot of people, like the doctor said, they're just not ready right now. But doesn't necessarily mean that they'll
yes.
never be ready. We're just trying to catch
Mm,
them in that moment when they are ready. So I see harm
mhm,
reduction as really important, but there are a lot of myths in terms of, oh, you're encouraging usage, you're supporting it,
Mhm.
you're enabling but
mm,
these are people who are going to be using regardless because of the situation that they're in. If you're on the
yeah.
street, you're cold, you're homeless, most likely you're going to be using substances to try to
Mhm,
mitigate some of the pain and the strife that comes with that. So if I can
yes.
help you while during that time and then also get you housed and then get you to treatment, then like there's steps to things. So harm reduction just
Mhm,
looks to fill the gaps
Mhm.
in those avenues.
mhm,
Andrew, how have you dealt with
mhm,
people who come with those, because it is such a, like,
Yeah.
you're a harm reduction,
mm,
therapist and
Yeah.
counselor. How do you deal with people, whether it's people you're dealing with directly at work, or whether it's people that ask, oh, what do you do? Oh, harm reduction. Oh, like, how
Hmm.
do you deal with the, I guess, the naysayers, or people who
mm,
are kind of discrediting the sense of the
Hmm.
importance of harm reduction?
That's a great question because I do have friends, family members, people in my church that are just like, oh, I don't know if I agree with what you're doing. And I try to give
mhm,
them some anecdotal evidence of I've seen clients who I've
mm,
responded to overdoses, we prolonged their life, and they're
mhm,
now working full-time jobs. They're now contributing in certain aspects in society. They'll come back and just be so thankful and so grateful for the opportunities that we have a facility that we're actually saving lives and helping them. So I'm saying I've
mhm,
seen my two eyes of how this benefits and how this works. So I try to paint people the picture for people in that sense to let them know
Mhm.
like there's real lives. Like take away the addiction. Like this is an actual human being.
yes.
This is
Yes.
a real
Absolutely.
person. And then we need to look at them in that sense of just what
Mhm,
they're dealing with right now doesn't necessarily mean they're going to be dealing with that forever. So I'm
mhm,
just trying to take this one moment of their life, make sure that they're happy, they're healthy,
Mhm.
and then move on. So I try to tell people that and try to paint that picture.
mhm,
That's amazing.
mhm,
Yeah, I did part of my internship. I had just an amazing experience of getting all sorts of different experiences, but I was in the methadone clinics, and again,
mhm,
I'm from a very
mhm,
small town, so I was
Yeah,
I was in um in the small town there in the methadone clinics, and you hear around town, like, oh, you're just enabling and that kind of stuff. But just seeing again, the positive impacts that it can have in terms of, that person is not going around now and, doing different drug deals around town. It's reducing the sense of
mhm,
needle use and needle
mhm,
sharing again. Fits in with the hepatitis and the HIV. This person is actually feeling supported. They get checkups by addiction workers, by doctors,
yeah,
and it's actually more in a sense controlled. And through that, they actually have a better chance of
mhm,
that sense of maintenance, and that sense of actually,
mhm,
um, even I know some people who've come off methadone haven't gone back to drugs, and they're
mhm,
living kind of the life they've always wanted to live. And like you
yeah,
said, they've got jobs
mhm,
and that kind of stuff. So just seeing
mhm,
the amazing thing that reduction can do, I think
mhm.
maybe eh, sometimes it's hard to convince people of that when they're not
it
actually
is.
boots on the ground,
Mhm,
and I
Yes.
think once you have that experience and you see the great work they're going to do, the teams that come together,
mhm,
even at the methadone clinic, people connected to that were addictions counselors that would actually get people set up
Mhm,
for even rehab facilities, and just the
yeah,
amazing teams that come together in this, and the lives that can change through that. Yeah, I love it.
mhm,
Yeah.
mhm.
Yeah, it's about instilling hope, really,
Yes.
um,
Yes.
in for them and also for their families. So, it can be difficult for families though to watch their
Mhm,
loved ones going through this cycle. And
mhm,
I think if there's one thing we need more of, it's family support. Um,
mhm,
mhm,
as well. So yeah, and I believe that hospitals are starting to run groups and so on to support families. without disclosing, patient information and confidential information and so on. So there are ways to do that, as well as the Al-Anon meetings and so on, where
Hmm.
people can get
Yeah,
support.
yeah,
Mhm.
Yeah.
that's great.
I used to run a family group, and
Mhm.
a majority of the family members, and it was tough to see because they just felt so helpless. And what do I do? How do I get my child to stop or my loved one to stop? And a lot of the group was just letting them know, like, it's not necessarily dependent on you. The most you can do is support. You can help to create an
Mhm.
avenue for opening up the doors for those type of things as well. But it doesn't necessarily mean that that person is ready right now to receive that help and everything.
Mhm.
So it is a really difficult place to be for a family member, and we know how difficult it is. Addiction never just impacts the individual; it impacts the broader ecosystem as well.
That
Mhm.
was the one of the most eye-opening things that I think I was able to experience. So when I did my internship, I got to um, I got to go into almost everything that addiction touches. So I was in the schools, I was in
Mhm.
the courts, I was in the psychiatric services, in the hospitals, I was in the methadone clinics, I was
Hmm.
at the agencies in the sense of group therapy. I was
Mhm.
Hmm.
working with children's aid. I was working with housing services, and to see kind
Mhm.
of addiction impact, like you have it's like you have families, you have health, you have
Mhm.
finances, you have again courts, you're now dealing with the criminal justice system. It just impacts
Mhm.
everything. And so treatment, it can be very you're not just dealing with the initial addiction, you're dealing with everything else that's impacting. We know that it
Mhm.
can, divorces,
Mhm.
dealing with grief, dealing with, again, a whole slew of things that
Mhm.
it takes a pretty delicate approach, and for someone to understand the whole systems aspect of it. And
Mhm.
yeah, and I think that's something that was eye-opening for me is, oh my gosh,
Mhm.
I'm in like every area here, and I don't even think I touched the whole agency in terms of things that I could have shadowed, but it's like, man, there's so many complexities when it comes to addiction. But I like what Adrian said, is that there's so many things that we can do to bring that sense of hope, right? Breaking down the
Hmm.
stigma of how, oh, and once someone's addicted, that's it. But breaking down the
Mhm.
stigmas in terms of like what can lead to change, and there is hope, and there are things that are happening within the community, and there are people around like Andrew,
Mhm.
like Adrian, in terms of teaching others to step into those fields. And I'm sure, Adrian,
Mhm.
as you said, the areas of family need more support. I'm sure you have a ton of ideas or even projects on the go, or you're putting a fire
Mhm.
under your students to really bridge those gaps. So I love that we're
Mhm.
thinking about all the areas and not just one area, from harm reduction to family support to anything
Yes.
in between.
Yeah,
Yes.
yeah. And of course, in terms of projects, I mean, Felicia is a great example
Yeah.
of someone who's taken the idea and run with it.
Absolutely, absolutely, right? Oh, you are listening to the Mental Health Hour on Love Bay Afrobeat Music Talk Radio. Please like, share, comment, and subscribe. Download our apps from the Apple App Store or Google Play. Please visit our website to donate. Your donation helps us continue serving you, our community. And we'd love to hear from you. Reach out to us at 437-778 3299. We are here serving you 24/7. Stay with us. We'll be right back. Amazing. And thank you, Dr. Adrian. That honestly, I'm like fangirling today. So thank you. Thank you so much. Thank you. And I'm so glad that we're talking about systems. I'm grateful that we're talking about really just breaking down the stigma. As you guys were talking, I was thinking about the fact that sometimes we have an image in our mind about who can be addicted or the types of people that can become addicted. But
Mhm.
really, everybody can become addicted to something,
Yeah.
Mm-hmm.
right?
Yeah.
And, there's high functioning um, pe- uh, people in society that are addicted to substances, but they're so good at hiding it that you
Yes.
don't even know, from like first responders to medical practitioners to teachers to our youth, and
Mhm.
so I really want our community to understand that just because someone hides it well doesn't mean that they're not struggling.
Yeah,
Mm-hmm.
yeah.
Yeah, it's a
It's
great
it,
point.
yeah.
Oh,
I was just gonna. Sorry, I was just gonna mention that you've triggered a thought really, and in
Yeah.
terms of thinking about what is a healthy human being, right?
mhm.
And a healthy person is someone who is free, free to
Yes.
choose good things,
Yeah.
and and not enslaved to
Mm,
medicating our wounds and hurts and
yes.
pains and so on. So, yeah, so it's a good reminder really to think in
Yes.
terms of seeking out help for the underlying problem if there
Yes.
is one, rather than trying to fix it
Mhm.
on one's own and then having a secondary problem that one has to live with and deal with for the rest of one's
Mm-hmm.
life.
Mhm.
Yeah.
Mhm.
I think that's so good. I love talking about the underlying, and that's what,
Mhm.
as you mentioned, Felicia, as you have someone who is clearly in very active addiction, and it's someone that maybe you don't know because they're maybe high functioning, they're able to hide it well, and
Mhm.
everyone
Mhm.
else in between. I often ask myself, and I'm like, what connects them? And I think
Mhm.
maybe I'm just touching part of it, but I think it is what I see there with the people that I've walked alongside in therapy, and then even people that I talk to outside, is this sense of safety and
Mhm.
soothing. These are the things that I see as underlying things that connects all these people, is that there's something in their life, past or present, where
Yeah.
there's not that sense of safety, right? Emotional safety, financial safety,
Mhm.
even people that
Mhm.
are, COVID and the impacts of COVID, and then what's happening in the world right now. It does
Yes.
something to our nervous system, right? There's a lack of safety. There's a lack of, these things that people then are like, okay, I need to soothe. I need to do
Yes.
something. I need to deal with this, right? And so
Mhm.
as I
Mhm.
work with people within addictions, I'm like, man, there's a lot of safety seeking and a lot of soothing seeking going on
Yeah.
here, right? And so finding out,
Mhm.
okay, what's the underlying, what's the core, what's happening here, right? Seeing addiction and attachment very, very connected, right?
Yes.
So through
Mhm.
relationships, through
Mhm.
parental relationships, through intimate relationships, and what can
Mhm.
come out of that. And um, as you start to see those deeper layers, man, it just makes me feel all the more for these people who are struggling at that level, where it's like, okay, I need to reach out. I need something. I need something. That struggle is
Mhm.
what really connects me in terms of to these people and things I've experienced in my own life, to be able to help. Hey,
Mhm.
what's really happening here that
Mhm.
has you feeling stuck in that cycle? As you said, Adrian,
Yes.
90% of them don't want to be there, right?
Yeah.
Mhm.
But as we see, that's okay. Like, what's keeping you there? If you don't want to be there,
Yeah.
what's happening? And so,
Mhm.
yeah, I love that idea of
Mhm.
that core, deeper issue, and really being able to speak to that and unpack it
Mhm.
and process it with them.
Yeah,
Yeah.
and I think being in this field has caused me to be so humble and grateful because
Mm-hmm.
you hear the stories that people tell you. And I've been in pockets of the city that is overt in terms of addiction, and it's like the stereotypical of what people are seeing and everything. People outside, people are homeless. I've been in
Mhm.
parts of the city that's very covert, and people wouldn't understand that there's addiction in that part of the city as well.
Mm-hmm.
And
Yeah.
like pockets of the city that people would never even think of because, well, it's like it's big houses, it's known as affluent and everything as well. But addiction lives there too.
Mhm.
And in each pocket of the
Mhm.
city, you're hearing some of the darker stories and
Mm-hmm.
people telling you these things and realizing that that could be me as well. If I went through that
Mm-hmm.
situation, if I were in that environment, if that happened to me, yeah, I might want to soothe with a substance. I might need to
Mm-hmm.
go out and get something because it's very dark, terrible things and traumatic things that happen to a lot of people.
Mhm.
So I think
Mhm.
that when we peel back the layer and understand where a lot of people in the population are coming from and what they're dealing with, it makes us understand a lot more in terms of that could be any one of us, and that causes you to kind of change the lens on what addiction is and trying to break down the barriers of stigma as well, to look at
Mhm.
people in just a human way and to just give people that grace of just like, this is what
Mhm.
happened. Okay, well, what can we do to help you, to
Yeah,
make you
that
feel
grace.
safe? Yeah.
Mhm.
Mm-hmm.
Absolutely. And,
Right.
I do think that there is a flip side as well. I know that we've talked about family, and walking alongside. And, I know that on one side, sometimes when someone's trying to hide their addiction, or they're going through the process of becoming sober, um, you know, they may tell lies, they may do all of these things which would cause hurt and
Hmm.
harm to family members and stuff like that. I mean, I know, again, Dr. Adrian, I'm going to big you up. One of our assignments that we had to do was to actually sit in the AA meetings and the
Hmm.
Al-Anons. And when I was sitting in the Al-Anon, like, I could hear the hurt behind the family members. It's just like, when are they going to get free from this addiction? They've lied to me again. And there's
Hmm.
that hurt and harm. So I even want to recognize those who may have a loved one that is, you know, going through an addiction, and you feel hurt, you feel betrayed. That is also a very normal part of the process.
Yes.
But it doesn't make it any easier. So even though, yes, we are saying that there needs to be grace, but at the same time, we're not overlooking the challenge and the nuances that go on in between as well.
Hmm.
Mm-hmm.
Yeah, yeah. And getting support for themselves, really. And
Mhm.
another piece that I would want to mention is young people. And just a shout out to young people to
Yes.
uh, to just be aware of the fact that um, a young person's brain doesn't fully develop until about 24, 25, sometimes a little
Hmm.
later. And using psychoactive substances can be it can really uh, set oneself up really
Mhm.
for the rest of their lives with problems. So
Mhm.
to delay onset of use
Mhm.
um, is really a good idea, because
Yes.
sometimes young people are getting the wrong message about
Mhm.
substances not really being unsafe or
Yeah.
harmful. And we want
Mhm.
to also kind of give that message for
Mhm.
informed use, really, or
Hmm.
non-use, which would be
Mhm.
ideal. Yeah,
Mhm. Yes, absolutely.
yeah. And we've talked a lot about the difficulties and the problems, and I would love us to just shift gears a little bit and talk about treatment. About the
Mhm.
hope, the possibilities, and
Yes.
and and where people can go to get
Mhm.
treatment.
Absolutely. All right, who wants to start the ball? Treatment, treatment, hope.
I think the good thing about treatment is it's becoming, especially with different policies happening now, like it's becoming a little bit more widestream and hopefully more available with them putting more money towards it. I know they're taking some money away from other things, but in the past, treatment was very difficult. I would send my clients to treatment, but they would want it right now, and it would take 3 to 6 months to get into
Mm-hmm.
treatment,
Mhm.
especially if you're looking for like an OHIP bed. So that was some of the problems. Or if you're looking for
Mhm.
private treatment, it becomes extremely expensive. We're looking at $10,000, $20,000 in that sense. But I do see a
Mhm.
trajectory where we're moving towards a treatment model where it's going to be widely available and more beds available. So I am looking forward to that, of seeing people have that moment of I want to change, and then usually you have to capture them right at that moment, because there's so many
Mhm.
shifts in the environment that occur that can change someone's mind or just cause them to go backwards. just because of what might be happening. So I am looking forward to more treatment beds, more treatment opportunities, and people looking towards treatment and capturing them in that moment too.
Yeah.
Mhm,
Yeah.
mhm, mhm. Yes, and I think that also I'm gonna obviously do my shameless pitch for psychotherapy. Just finding
Mhm.
somebody that is knowledgeable on addictions, right? And because you really, at the end of the day, you also have to get to the root cause of what is actually driving you to the addiction itself, right? So obviously I'm not saying that you're going to do that in isolation. Of course you have to again
Mm,
deal with the biological first, right?
yeah.
But I think alongside your mental health care to really get to the bottom and the root of the problems that you're facing, the
Yeah.
trauma. Mm-hmm.
One of the things I've been able to do there is I love psychoeducation. I love
Yes.
it, and I always tell clients as like, because I share a lot of um, diagrams that I've simplified, and I'll say to clients, hey, like, um, we're going to personalize this to you. I really make it kind of grounded and personal. And one of the things I love just about psychoeducation is that people will start to see themselves. It removes barriers of shame to be like, wow,
Yes.
like I'm finally understanding myself, finally
Mhm.
understanding my body. I'm finally understanding why I keep being drawn towards it. And they have this awareness and this understanding where they don't just feel, oh, you're cursed or you're a bad person or
Mm,
it breaks down those barriers where they're able to be like, wow, I was so impacted with this within my childhood and this experience, and I actually can tell that this is the time I started to reach out to these things to soothe, and then oh my gosh, of course it led into
mm,
this, and now it's here, and I'm just it's a thing that my body will go straight to. It's familiarized. I'm here, and oh my gosh, like I'm getting this understanding, and from there we
mm,
can do lots of good unpacking, lots of good understanding, lots of good work to move forward, to work through that deeper sense of trauma. So I use
mm,
psychoeducation in the sense of just allowing that person to break down barriers of shame,
mhm,
to feel their humanity affirmed and what they've been through, to not
mhm,
pathologize all the time, right?
Mhm.
Everyone's, there's so much pathology and out there, but to
mm,
actually make sense of things, to take away that sense of judgment and to
Yeah.
work through it on that level.
mhm,
It's some of
mhm,
my favorite things to do, and the realizations that clients have,
mhm,
to see them, yeah, to see them be like, wow, this is what's been happening. This makes
Yeah.
sense. It's not
mhm,
it's
Mhm.
not a surprise to me anymore, and something like that. So yeah,
Yeah.
it's a great experience to see that.
Yeah, and I'd just like to say, just to piggyback on that too, it's like the
mhm.
shame, the guilt, the isolation is really what keeps people
Yeah.
with addiction. I find that community is what really helps people to bridge out.
Mm,
To somebody, identifying with other people, knowing that you're not the only person that's struggling, because oftentimes
mhm.
it feels like I'm the only person dealing with this. I feel weak. I'm not good enough. That's therefore I cannot change. Um,
Yes.
it's very difficult to change, but it's a hard work and hard effort that does pay off. And
Mhm,
we've all seen people in this field actually change, actually stop using the
Mm,
substances or reduce their usage and been able to go on a different path, a different trajectory. So
mhm,
that
mhm,
thing, it is possible. I know when you're in the midst of the addiction, it feels like it's the most impossible thing and that you're not able to,
mhm,
you're not strong enough. And you're right, you're not strong enough to do it by yourself, but within
mhm,
within getting help and within just opening up and not having isolation, and not denying anything anymore and just being open and honest with people, it really does
mm,
all the
mhm.
things that are happening, and it does help to relieve that stress and that pain that you don't have to carry that on your own, but you do have
mhm.
Mhm.
people to support you.
It's great. Yeah.
Absolutely. Yeah.
So, yeah, piggybacking on what both of you have said, uh, just that motivation
Yes.
recognized as
Yes.
as a big factor, obviously, uh,
Mm-hmm.
to for someone to be ready now. And often people are not ready, willing, able, and there are things that people working with them, family members, etc., can do to help them to become motivated, to become ready. So increasing their confidence and increasing their competence by giving them some skills and so on to actually take that first step
Mhm.
is an important piece that we can, any one of us can do. Yeah. And
Mm-hmm.
there the first, there are many entry points that people can connect with services and professionals. You
Mm-hmm.
mentioned, Felicia,
Yes.
psychotherapy. A
Yes.
psychotherapist can direct people, but people
Mm-hmm.
can also look up information on Connex Ontario if they're
Yeah.
in Ontario, and go
Mm-hmm.
to MARS, which is the Metro Addiction Assessment and Referral Service,
Mm-hmm.
and get a full blown assessment and find out
Yes.
what's available. So there are services,
Yes.
and you can always, of course, also talk to your doctor if you have
Mm-hmm.
a
Mhm.
doctor. So connecting
Yeah.
with professionals is a good starting point.
Mhm.
Mm-hmm. Absolutely, absolutely. I do. We do have some encouragements in the chat. So great seeing Andrew Roach a part of this live stream. Absolutely, Felicia. Yeah, yes, Mr. Roach. Shifting from seeing an addiction to a substance or behavior to the underlying rewards, feeling less lonely, feeling something, not feeling crappy because of the substance or emptiness felt. Absolutely. Absolutely. And also seeing them as addicts, nope. They are individuals with an
Mhm.
addiction.
Yeah.
Absolutely. Absolutely. I kind of wanted to touch before, as we, we're winding down, we have limited time, so I want to make sure we make the best use of this time, is about relapse, because I think
Mhm.
that a lot of people don't understand uh, relapse and how, I guess, easy it is for someone to experience it in their recovery. So, can we talk a little bit about that? Well, we got an extra 10 minutes, everybody. So, we actually have 20
Awesome.
minutes. So, we don't have to
Oh,
rush it.
perfect.
All
Okay.
right.
I think that another thing that is a misconception is that, oh, once you start the trajectory of not using that, you're not going to relapse. But relapse is a very common thing that happens in the recovery process. That's something that's going to happen, and it's also a learning opportunity. So when people relapse, when I have clients that relapse per se, I try not to get them to try to reframe it in the sense of, okay, what were the triggers that happened? What environment were you in?
Mhm.
This is all learning things. This is all things that we can
Mhm.
actually gather information from so that it doesn't
Yes.
happen again. So relapse is a very common effect of when people are trying to stop using, but it can actually be a really beneficial tool and beneficial use for the
Mhm.
client who is relapsing, because we can gather so much information from it to help them
Mhm.
on the trajectory of their journey.
Yes.
Yeah.
Yes.
Yeah.
Absolutely.
I
Absolutely.
think I think you said it great there. I think normalizing or just seeing that it is typically part of the process. I think what's that, Dr. Adrian, the stages of change model, is that
Yeah.
Yes,
where relapse is actually
Francesca.
part of the stages of change,
Mhm.
right? Maintenance
Mhm.
relapse is actually, part of that. And so I think when I can talk clients through that, and again, it breaks that shame piece down. It breaks
Yeah.
that, because sometimes people feel like, well, I got to start at stage one again, and that's so exhausting. And then
Mm.
they feel isolated. They feel they let everyone down. But helping them walk through that point, and then taking what Andrew said is also the learning from here. Okay, what were the triggers around here? How can we
Mm.
learn from this? What led into that, right? So breaking down the shame of the initial relapse, and then like how can we use this, to go back into that sense of maintenance, to really go
Yeah.
back into that sense of, okay, we don't necessarily have to start from square one again, right?
Mhm.
Right.
So yeah,
Mm.
I,
I love that you brought that up. I think you said it
yeah.
great.
And I also try to, and I know it's very difficult for family members to see
Mm,
somebody relapse because they might have
Yeah.
been in treatment and you think that things are going well.
mm,
So when you see them relapse, it is devastating. But I always try to reframe it in the sense of, if there's a baby who's learning to walk, they're going to be falling. They're going to get up again and they're going to
mm,
fall. You're not going
Mm,
to get angry at that baby for trying to walk. You're going to be
yes.
excited that they're
mm,
taking their steps. So it's the same way that we're looking
Yes.
at addiction when we're like, someone is trying to get up,
Mhm.
they fall
Mhm.
down, they get up again, but eventually that baby will walk. So as long as we continue to support and then create an environment for that baby to
Mm.
start walking, then it's going to do
mm,
that. The same way with our family members with the addiction. It's going to be frustrating as a family member, but please continue to create an environment that is supportive of that person to get up as well.
mhm.
Yeah,
Absolutely.
yeah. So we want to also acknowledge that there's a kind of a shift in thinking more recently about
Mhm.
moving from, just dealing with relapses in an episodic way, that
Mm.
okay, so let's go back to treatment again, to thinking in terms of like a wraparound model, a more
Mm.
chronic care kind of a chronic disease kind of model.
Mhm.
So, looking at what happens when a person comes
Mhm.
out of treatment, and where does the aftercare fit in, and the ongoing
Mm.
supports, and
Yes.
supporting the family members as well, and also learning about how relapse happens. Like, for instance,
Yes.
people go into denial mode, and they start letting go of their program and so on. So being
Mm,
aware of that right from the get go, and having a treatment plan that actually is not boring. Because when people start getting bored, uh,
Yeah.
they
Mhm.
they don't want to show up or go.
Mhm.
So you want to keep that dynamic as well, and
Yeah.
mm,
it needs to grow with the person. And
yeah,
yeah, so there are ways out of this cycle, this enslavement, this trap
Yes.
of addiction. and
Yes.
and yeah, it's important to see that as
Mhm.
something that I can do, to
mm.
feel
Absolutely.
hopeful. Yeah.
There's
Absolutely.
one thing I would love to ask both of you, just in terms of a reason I see people relapse that I find can be very quite common.
Mhm.
But it's as you're going through that process, right? There's things that you're losing, right?
Mhm.
Like the friends that you have gained, the
Mhm.
kind of
Mhm.
familiarity of certain things. It's almost like you're starting brand new, which can be very daunting.
Mhm.
And not only is it the starting the brand new, but you feel at that usually, maybe at a later age, like I'm starting all over again, and that's even more daunting.
Mhm.
It's like I don't know. I don't even have a SIN number, a driver's license. I don't even have my high school diploma. I don't even know what I would
Mhm.
do for work. I don't know where I'm gonna live. I don't know. It
Mhm.
feels so daunting to feel like not only just starting over and starting something new, but like I'm so far behind. And I think
Mhm.
that can lead people into that sense of numbing, into that sense of overwhelm, into that sense of, again, all that stuff happening in a nervous system that drives them to what they know
Mhm.
will soothe them, even if only
Yeah.
temporarily. So how do you what kind of hope or what kind of help do we give these people that are feeling that daunting aspect of I feel I'm starting over again.
Mhm.
I feel like I'm starting from the bottom.
Mhm.
What's that gonna look like? Is this gonna be
Yeah.
too much work for me? What if I screw up? Like there's all of that there.
Mhm.
How do we help people in that?
Mhm.
You're so right because that's a daunting thing and it can feel very overwhelming and feel like you just have your head underwater and sometimes over and sometimes
Mm,
under. So what I
Yes.
try to do for clients is to try to break it down step by step, not necessarily look
Mhm.
at the whole picture, but let's look at one specific thing. Like, okay, we're
Mhm.
looking at job. Okay, let's try to look at different careers. Let's try to look at different things that you can do. Does that look like going to school? Does that look like changing certain things or connecting with someone else that maybe had like a roofing job or this or that? And then we're going
Mhm.
to try and talk about like maybe let's go to a group that you can meet people who are like-minded and going through the same things. And but
Yes.
as long as we break it down step by step, I feel like it's a little bit easier because once you start looking at the bigger picture, of course they're going to start using again,
Mm-hmm.
because that's so overwhelming. And
Mm-hmm.
Yes.
so many people can feel like that and think like that. But I think
Mhm.
just breaking down piece by piece really does help a client to reframe it and say, like, okay, this I can handle today. Tomorrow I'm going to worry about something else. And then maybe I can handle that too, within the
Mm,
community, within people helping me as well.
Yeah.
mhm.
Oh,
I think
Mhm.
that also, the AA model epitomizes something really with their those little uh, I forget, for some reason the words escaping me right now. But when you go, oh, a chip, you go up and you get your desire chip, and then
Hmm.
and
Mm,
1 month chip, and so on. So
mhm.
I think that's an important lesson in that, to break it down to it's
Mhm.
one day at a time, and sometimes it
Yes.
feels like it's 1 hour at a time, and
Yeah.
to
Yes.
want to keep, in the beginning, yes, a person might need to go to, as they say, 90 meetings in 90 days
mm-hmm.
to
Hmm.
keep up their motivation and so on. But yeah, to keep it manageable, to keep
Yes.
and short term, uh,
Mhm.
can be helpful. And
Yeah.
it's occurring to me that we haven't even touched on process and behavioral addictions, which is also such a big
Mm-hmm.
Yes.
idea these days,
Hmm.
isn't it? Yeah.
Mm-hmm.
Absolutely.
Maybe need a part two.
I think
Yeah.
so.
You just spin it
I,
back.
I called it, didn't I?
Mm-hmm.
Because it's such a huge topic that I think
Mm-hmm.
that we need to talk about and really
Yeah.
shed more
Yeah.
light on. Absolutely.
Yeah. Can I ask? I mean, maybe I'm just going to come up with more questions, unless there's something specific that someone wants to go into. But there's just all these
Mhm.
questions coming to my mind. Of,
Mm.
do you mind if I go with one?
Go with it.
Please
Go with
do.
it. Go
Yeah,
with
I've been doing it all night, so I might as well just continue. Um, I think of the cycle of addiction in relation to the justice system,
Mm,
and oftentimes it can just be a sense of, and I get there's a whole other side of it. I get that, breaking the law. I get these things, but then it's kind of like you're going to jail, or here we're sentencing you,
mm,
and it could seem like this thing where maybe, people in the court systems necessarily aren't, educated on all the different,
Mhm.
facets of addiction that we've talked about, and
mm,
the sense of trauma, and things that people are experiencing that lead into addiction. And so it can just
mm,
seem like those people that are struggling with addiction, once they get into the justice system, it's almost hard to get out, right?
Yeah.
It's very
mm,
hard to get out, right?
Mhm.
You get in the justice system, maybe you get on
mm,
parole, and now there's all these demands on you again, which we talked about, overwhelm, what that could lead to. And so people maybe go
Mhm.
back into to behaviors that they have known, and it almost
Yeah.
seems like there's
mm,
this recurring sense of reoffending
mm,
and relapse. And, what do we do? What do we do? Is this
mm,
something that you two have kind of, or all three of you have maybe come across or have
Yeah.
questioned about
mm,
as well? Like,
Yeah.
what do we do in
mm,
Uh,
terms of people being lost and stuck in the justice system
mm,
while dealing with addiction?
I had the opportunity of working in a drug treatment court as well. So
mm,
Oh,
weekly, we would meet with clients, and
mhm,
if they had crimes, and then we were deemed to kind of situate around the addiction. So if there is like theft under 5,000, if there's breaking into cars, if there's things that are nonviolent
mm,
offenses, but we can realize that a lot of it was due to their drug seeking behavior, and they're just trying to
mm,
justify that.
mm,
We would talk to the judge, and we would try to get them off of seeing jail time and actually connected with people in the community, like a
mhm,
psychiatrist, a
mm,
doctor, addictions counselor. And then that was
mhm,
more of that was mandated in terms of them seeing us, and then so just to
mhm,
avoid jail time. So I would love to see something like that happen on a wider scale,
mhm.
because there's so many people.
Advocacy.
yeah, advocacy for it,
Yeah.
because I've also seen
Mm,
the flip side of when we're working front lines, people get out of jail, they come right back to using immediately,
Mm-hmm.
yeah.
and they're just overdosing. And it's like that's what they know. But if they don't are not connected to anybody or anything, they're gonna go back to what they're
Mm,
familiar with. But if you're
mm,
giving someone another chance to be like, hey, we're not sending you to jail this time, which is a huge relief for the client as well. And then we're gonna connect you with people, and then it kind of gets them to open up and talk about things that they may have never wanted to even talk about or
Mm-hmm.
thought were an issue. And I've seen it help
mm,
so many people in my time with drug treatment court. So I'd love to see that happen on a wider scale. So I think that's a great
Yeah.
question, and I think that's
Yeah.
something that we
mm,
need to see more of.
mhm,
Absolutely.
mhm.
Mm. Any thoughts from you, Felicia or Dr. Adrian?
Yeah, I mean, I can't say that I have personal experience in this area, but as you were speaking about the fact that when people go back, into everyday life after they're released from prison, that they're going back to, the things that they know. One of the things that I talk to my clients about is, especially when it relates to addictive behaviors and stuff like that, is that in itself is a coping mechanism. That's a backpack that you've
Yeah.
always worn, right?
Mhm.
So if you don't create a new backpack with new coping strategies and new support systems, right, you're not going to go you're not going to automatically change and
Mhm.
stuff. It's going to take time, right? Because what people end up doing is that when they end up in maybe a different scenario, it's still the same patterns that are repeating itself, and then
Mm-hmm.
when they're triggered, then they go back to the old backpack, right? So I love that there's programs like this that could really, one, give them a chance, give them grace, give them mercy, right?
Yeah.
Mm-hmm.
Yeah.
um but at the same time, really, putting, I guess, actions behind the words, and is
Yeah.
actually like giving them the support system, because we don't heal in isolation. We
Yeah.
heal
Mm-hmm.
as a part of community and
Mhm.
accountability.
Mm-hmm.
So I
Yeah.
love
And
that.
without that, you're kind of setting them up, because what else are you going to do? Like you were
Absolutely.
separated from society for months, sometimes years at a time, and you're gonna go
Mm-hmm.
back to what you know, and then you have a record. So it's gonna be harder to get a job, it's gonna be harder to get
Yeah.
housing, it's gonna be harder to so there's gonna be so many
Yeah,
things like working against you that you're gonna go back to substances. So
Mm-hmm.
there does need to be a
absolutely.
change and a viewpoint change on that, where we're looking
Yeah.
this at more as like a mental health, a medical issue, as opposed to you're breaking the law and it's a legal issue.
Mm-hmm.
Absolutely.
This is a wishful thinking part of this question, and I know I maybe cut you off, Dr. Adrian, but hopefully you can respond to this as well, and it could be a part of your response. But is it too wishful thinking to think of, like, with these fields, these sectors, um, for people to have mental health and addiction training? Like, I think of
Mm,
judges, police officers, lawyers. Like, I just think of, like, these areas where we're dealing with people's lives, and to this extent, to have that somehow within their program or a certificate that they're encouraged to
mm,
get, that this thing, to because we've been talking a lot even at the start of breaking down stigma, which is in a sense bringing understanding, bringing awareness. We want that for everyone across the community,
mm,
for the
mhm,
families, the community, the person involved in it themselves. And I'm just thinking with these jobs, like, and the reason I bring this up is because you're talking about advocacy. And as I worked for the addictions agency, when I was doing my internship, we were in the courts, and it almost
Mhm.
just seemed like, cool, you can say your piece, or you can share with the lawyer your piece, but this person still broke the law. This is still
Yeah.
their second charge, and here you go. And it's just like, man.
mm,
So
mhm,
yeah, that's kind of the thought. Like, I just feel like more awareness, more training, more
Mhm.
understanding, more breaking those stigmas.
mm,
Yeah.
Could it help, right?
mhm,
Mhm.
I think that's what it takes.
mhm,
I've been fortunate enough to do groups in terms of breaking stigma with police officers and paramedics, and there are some judges that are learning more about the
Oh,
addiction
nice.
field and what that looks like. And so during our drug treatment court, we had two specific judges that were well versed in addictions, and they
mm,
were really great in terms of having some leniency and understanding
Big
the
ups to
the
them.
issues that come along with
Wow.
that. And I'm hoping that's something that they would spread with other judges, because
Wow.
what you said, Josh, is what usually happens is judges don't necessarily have the time for it. It's just kind of black and white. But with this one,
Yeah.
there's so much gray that happens that we do have to know when to, okay, is this punishment
Mm.
worthy? Is this not? Like, can we kind of
Mm,
put them in somewhere else? So I do think that those things need to happen, but it is a lot of just breaking stigma and a lot of stereotypes that come along with it. And I think once we have that education out there, and have more conversations like this,
yeah,
and then we're kind of personalizing it for clients, we'll see those things happen. But
that's great.
things like this need to happen more often for sure.
Yeah.
Yeah, I've been to drug treatment court as well many, many years ago, but I don't know whether it's changed now. But it was a youth drug treatment court, and it was
Mm-hmm.
very impressive, really, the way it
Mm,
functioned. Yeah.
Yeah.
Um, and since then, of course, there's also mental health court where
Mm.
individuals with mental health issues
Wow.
dealt with there, and there is there's an understanding, and then there are forensic teams that also go from hospitals to the prisons, and so they do work across these disciplines. Yeah,
Mm.
I think there's more of a need for it, and hopefully it's going to change going forward
Mm-hmm.
as there's
Mm.
more understanding of the need. Yeah.
mhm.
Mhm. Man, I don't want this conversation
I
to
know.
end, but we
Yeah.
are at time. But yes, I think we'll definitely have to pursue a part two if you guys will come back, because I think
Mhm.
that we're
Of
just
course.
again just scratching the surface
Mm-hmm.
of things that we could talk about. And so, yeah, as we come to the end of tonight's conversation, I just want to take a moment to acknowledge the depth of what we explored together. Tonight reminded us that behind every behavior, there is a story, a history, a lived experience that deserves to be understood and not judged. Addiction is not a moral failure, it is often a response to pain, disconnection, and survival. And when we begin to shift our perspective from judgment to compassion, we open the door to real healing, not just for individuals, but for families, communities, and systems as a whole. I want to thank our incredible panelists tonight, Dr. Adrian Sequeira, Josh Dale, and Andrew Roach, for bringing their insight, their experience, and their heart into this conversation. And to our listeners, thank you for showing up, for listening, for dropping those comments in the chat, and for being willing to reflect. If tonight's conversation stirred something for you, I want to gently remind you, you don't have to carry it alone. Support is available, healing is possible, and you are worthy of both. And before we go, I want to invite you to join us next week for another powerful conversation on She Speaks on the Mental Health Hour. We'll be exploring the kids are not okay, how parents can show up and support. I'll be joined by a truly special mother daughter duo, Ruth Virgo and Chantel Gray, registered social workers and the powerhouse behind Winrose Oasis Counseling Services. Together, they bring not only clinical expertise, but a shared generational perspective on healing, supporting children, youth, families, and communities through life challenges with care that is both culturally responsive and deeply rooted in connection. Next week, we'll be talking about the growing mental health challenges facing children and youth today, how parents and caregivers can better understand what this generation is navigating, and practical ways to build connection, foster resilience, and create supportive environments for healing. Because while it can feel like our kids are struggling in ways we don't always fully understand, they don't have to navigate it alone, and neither do we. So you don't want to miss it. Again, you've been listening to the Mental Health Hour on Love Bay Afrobeat Music Talk Radio. And until next time, take care of yourselves and take care of each other. Peace out.
See ya.
Bye.